So to describe Stormy, that's a challenge because he's kind of indescribable, and anybody who ever met him remembers him. He loved music, he loved adventure, he loved learning. He'd come home from work and we'd meet somewhere in the French Quarter and we'd walk for miles. And sometimes we'd meet at Envie, we'd have a cup of coffee, which is his drink of choice, and we'd literally walk for hours.
Stormy was a gentleman who had an advanced lung illness, and he was cared for by the outpatient physicians in both pulmonary as well as our palliative medicine department.
So Stormy would fall into a medical valley, and he would work at like hell and do everything he was told, and he'd come back to a functioning level, and then he'd hit another crisis. And that would go on for months, and he'd be fine, and he'd work himself back up, but he never got back up to that other level. And so the pulmonologist explained that what the likely scenario of his disease process would be, the crises would come more often, and he would be less and less likely to come back to a functioning level.
I met Stormy first when he was in the ICU. We were consulted to address goals of care. He was already very clear in the fact that he did not want to be intubated, he did not want to have chest compressions, and so he was a DNI code status. I think that Stormy's case is a great example of how palliative care should work.
Palliative medicine is a relatively new specialty, and it really is an extra layer of support for people with serious illness and their families, really to make sure that every day is a great day. We focus on a couple of things. One is expert pain and symptom management. The second thing that we work on is really navigating the healthcare system, which is complicated. We're very proud of the fact that we're the only hospital in the Southeast that is certified by the Joint Commission for our palliative care program.
Stormy always told me it was important for him to be in control of his body, his functions, and to be able to be active. Palliative care team took over and asked Stormy questions about what were his priorities, what did he want.
Palliative care is not necessarily a level of care, it's a specialty. And we help any patients with serious illnesses, whether their disease can be cured or not cured, whether they're very early on in their disease or very, very late.
There's a common misconception that palliative care is the end of the road, that we only take care of people at the end of their life. But really, we want to get involved much earlier in that illness trajectory, to develop those relationships, to guide people along that journey.
Palliative care gave him the breathing space to say, okay, I have these conditions, but I don't have to focus on all these medical decisions. I can focus on my life right now.
So it was nice to be able to see how that continuity of care continued from not only the outpatient setting to the inpatient setting, and then assisted with the transition at that point from inpatient to hospice.
And Stormy's wish was ice cream and Mojo coffee, and so Dr. Nick came and brought him ice cream and fed him ice cream, and Dr. Harlton came the next day with a big cup of Mojos. Once he passed, the chaplain came in and explained to us what the process was and what the practical things we had to do, and walked us through it and helped us make the phone calls we need to make and contact the people we needed to contact. And that, in a time of grief, had that happened in some other manner, would have been a very different experience.
Everything that I do is with the intent of making their lives slightly better, bringing a smile to someone's face during arguably the most difficult times of their lives.
The staff was just extraordinary. They were there frequently. not intrusively, but to make sure he was comfortable, to make sure they changed the medication, how they gave it to him, when they gave it to him, totally based on what he needed at the moment.
A lesson that I already knew, but just gets reinforced whenever I see patients like Stormy, is that even though there are things we can't control, like when death comes, we can't control how we choose to meet it and how we derive meaning and dignity from those moments. And Stormy is a glowing example of that.